Good morning. This is a phenomenal turnout. All in all, we're going to have over 400 people here today that have an interest in helping youth, that have a concern about the number of young people using drugs and alcohol. I am the founder of a group called Our Young Addicts, and we are a community of parents and professionals. Together, we share experience, we offer resources, and we provide a lot of hope to families that are going through addiction with their kid. We partnered with Know the Truth because they're in the schools every day, 5 days a week, 9 months a year, talking to kids and building rapport. So we thought this was a great opportunity to bring our two groups together and all of you and start to move towards some real solutions. You'll hear a little bit more about my story throughout the day. I am a mom of a kid in recovery, very proud to state that today. That's my statistic that I'm proud of. But we'd like that to be the statistic that we hear about far more often. So without any more, we're going to jump right into the conference. Thanks for being here.
My name is Adam Peterson, and I'm a director on staff at Minnesota Adult and Teen Challenge, which you'll hear a little bit about them throughout the day today as well. They're one of our key sponsors, but I oversee a program called Know the Truth that goes into the high schools and middle schools. It started right around 10 years ago, going into the high schools and middle schools. I recognize some faces of some health teachers and chemical dependency counselors that are here today that have had us in the classrooms. We're really about prevention. But one of the big things is we know this isn't just going to be a one-size-fits-all, that our presentation, our one day in the classroom, really how much is that going to do if the other parties, if we don't have a multifaceted approach, if we aren't connecting people and really working together. And so a few years ago, we started these community forums, and we started in Anoka County, and the county attorney and the sheriff approached us about the growing issue in heroin overdoses and opioid overdose deaths. And it was kind of in response to a bunch of overdoses in Anoka County. And we had a huge turnout, and we saw a need to really connect people from the different groups and different entities. One of the common things that we've heard at these community forums that we've done now in numerous counties throughout the state is when an attendee comes and they see someone from the sheriff's department and the county attorney's office and the local police department and the school, they say, "I never thought you guys worked together." Which seems crazy, right? Of course we work together, but that's not always a common a thought for people. And so we really want to correct that. So today, the format throughout the panels, you'll hear a little bit more about that in just a moment, but it's really about bringing people from different fields and different perspectives and really trying to end the stigma of being afraid to talk about what works for me, because what if it doesn't work for you? We're really sick and tired of hearing about the problem itself. The statistic that we've really landed on for this conference is that 90% of adults that meet the medical criteria for addiction started before the age of 18. That's pretty much all we need to know, right? We know all the other statistics, the amount of prescription pill abuse, less than 5% of the world's population here in the United States. We consume over 70% of the world's medication. We know all this stuff. You guys, a lot of you on the front lines are dealing with this. And so we want to help provide solutions throughout the day. And so that is really what this conference is about. We want to thank our sponsors, Melrose Center. You'll hear from them a little bit throughout the day as well. Minnesota Adult and Teen Challenge, Recovery Brands, and The Retreat. This would not be possible without our sponsors. We also want to thank Hennepin Technical College and Lancer Catering, who will be fueling us all day with coffee. We also want to thank all our exhibitors that are here. You all received a program with an exhibitor bingo card. Get as many of those. Talk to these individuals. These individuals are working hard, and they have resources. One thing you're going to hear throughout the day, especially through some of the personal stories, is there was a lack of connection between resources. One entity wouldn't know where to go with the problem that they had. And that's really important. And that's what these resources and exhibitors are here for today. Another really exciting thing, which we'll have it up on the screen over lunch and in the afternoon, but we have Bill from from Insight Formation, who is going to be doing a framework throughout the day. So they have developed a framework, a strategy model for the opioid crisis. And you're going to see it, and it'll all make sense over lunch and a little bit throughout the day. But he's going to be pulling information from, he's got a wiki technology that's going to be pulling information on the things our panelists are talking about and really putting the solutions together. So then at the end of the day, we're really going to actually be able to move from statistics to solutions, actually have action items that we can do and bring back to the demographics that we serve. And so we're really excited and really honored that he's willing to be here today and do that completely free of charge for us. And so we're really excited about that. So at this time, and this is what allowed us to start a little bit later without worry about the rest of the day. So we had a few individuals that were going to be here, legislators, but as many of you know, right now they're in session. And so they're a little bit busy with bills and other stuff like that. I was a little disappointed. I told them I wasn't going to talk to them for a couple of weeks because they weren't able to make it. But we do have a video message from Amy Klobuchar. I'm going to play that now, and then we're going to move into our first panel.
Hello to all my friends gathered for the Minnesota Adult and Teen Challenge Summit. I think you know I would much rather be there with you in person. I've been to your events many times in the past, but there are just a few things going on right now, and I'm just honored to join you via video. I know you have a great group of professionals working in youth addiction gathered there today. I'd like to thank you for being there for people who are struggling to break free from addiction. As many of you know, before I was elected to the Senate, I spent 8 years serving as chief prosecutor in Hennepin County. Drug cases made up about 1/3 of our caseload, which meant we handled everything from trafficking and selling to production and manufacturing. I saw firsthand how drug abuse destroyed Minnesota families, and as I've traveled around the state as senator, I've heard heartbreaking stories from people about how this issue is affecting entire communities. That's why I introduced the bipartisan Comprehensive Addiction and Recovery Act, which passed the Senate earlier this year. One of the most important pieces of this legislation is the education component. It expands prevention and education efforts, particularly aimed at teens, caretakers, and the elderly, to prevent the abuse of opioids and heroin and to promote treatment and recovery. The legislation also expands disposal sites for unwanted prescription medications to keep them out of the hands of children and adolescents. That's something I've worked on for a long time, and I introduced the bill that passed with Republican Senator John Cornyn of Texas that allows for pharmacies and others to take back those drugs. The bill we just passed also strengthens prescription drug monitoring programs to help states monitor and track prescription drug diversion. I am really excited that finally the country is paying attention to what's been happening, something that Teen Challenge has known about for a very, very long time. I remember all of those dinners I attended as county attorney and then as senator, where the beautiful Teen Challenge choir would sing to us, and my favorite moments was when I was a prosecutor and I'd be introduced and certain members of the choir would go, "Yay!" You know, I guess that was good. And the reason it was good is because our prosecutors, our office, was willing to give someone a better chance, someone a second chance, someone the Teen Challenge chance for rehabilitation and treatment. People addicted to drugs and alcohol, they can once again be loving family members through faith, through the right treatment. They can be great employees and productive members of our society. You know that for years my dad battled alcoholism. I still remember those late nights waiting and worrying, waiting to see if he was coming back. Well, in my dad's case, he was, in his own words, the title of his own book, Pursued by Grace. And he was able to get sober and turn his life around, just like so many people you've helped over the past 30 plus years. In his case, he's now 88, sober, and happily married. That's the future. I mean, maybe everyone wants to be 88 right now, but I saw that future in him because he was pursued by grace. Thank you for helping people turn their lives around. You're making a life-saving difference every day. Enjoy the rest of today's summit. You've earned it.
All right. At this time, we're going to move into our first panel. I'll invite all of the first panel members to come up and take their place on the stage. And this is kind of the format for today. Is we've got 4 different panels focusing on early intervention, identifying needs, collaboration, and moving forward. And we've got people from all different fields of study on each of the panels. We've got individuals from law enforcement, individuals from the legal system, the medical field, mental health, treatment, recovery, prevention, intervention, adolescence. All of these different fields, they've come together today to share their perspectives on this topic. And so the way the next 50 minutes is going to go is each panel member is going to take a couple moments to introduce themselves, share kind of their level of expertise, why they're here today. And then this morning, they will be answering the question of, each one of them is going to just answer the question of why early intervention is important to them. And then at that point, we'll move into a time of a few scripted questions, some discussion topics. And then the last 10 minutes, we're going to channel our inner youth, right? And continue with the social media and the texting and all of that stuff, LOL, OMG, right? And we're going to do text in your questions. So up on the screen, we will have the number to text in. And the last 10 minutes will be slated for your questions that you have. Please feel free to direct those to a specific panel member, or if it's just a general question, some of the panel will answer. And so that's kind of the plan for the 4 panels. We're also really excited to have Chris Bailey here today, who will be our keynote right after lunch. And then we've also got some different speakers that are going to be sharing some personal stories, some stories of addiction, some stories of recovery. As Rose talked about, she'll be sharing a little bit of her story and her son's road to recovery. And we're going to have that throughout the day as well. We are really excited. Please don't let this just be another conference. Really get something out of today. We've put a lot of work on the front end, and these panelists have volunteered their time to come and share their knowledge with you. Make sure to use that notes page. It's small, so I think all of you can fill it out, no problem. But write some things down today that you're going to be able to take back with you, because that's what we're really focusing on today in this conference, is moving forward and getting skills and tools to implement in the work that we do every single day. We want you to feel supported. We want you to feel equipped. We know that the workload that you're probably facing can be overwhelming at times, but our panelists, our sponsors, our organizations want to equip you and want to support you. So at this time, we will start our first panel on early intervention. And so we'll just start down at the end here. Just please introduce yourself, take a couple minutes to share where you are, level of expertise, and then just answer that question of why early intervention is important to you.
Okay. Good morning. I'm Brent Thompson. I'm pharmacy director at First Light Health System in Mora, Minnesota. Can't hear.
Yep.
There you go. Is that better? Sorry. So yeah, I'm pharmacy director at First Light Health System in Mora, Minnesota. We serve Kanabec and Pine County in East Central Minnesota. I've been there a number of years. I think I've been involved in a lot of things, but probably the reason I'm here today is I'm involved in our local substance abuse coalition for Kanabec County. And I've been kind of working on this issue for a few years now. You know, why is early intervention important? I think one of the large messages that I've taken away in the last few years as I've studied this and presented and shared a lot of this information is there's a tremendous lack of awareness. And I think before we can begin prevention and really getting to the early issues, everybody needs to know what we're talking about. And I'm talking about kids, I'm talking about parents, I'm talking about teachers. We all sit in this room, probably most of us know the statistics, we know the tragedy, we understand the crisis, but my experience, most people don't.
Hi, I'm Linda Skillingstad. I am a therapist in Prairie Care Partial Hospitalization So it is a psychiatric setting, and the part that I work in, kids do get to go home at night, but are just on that edge of needing inpatient. Our job is to stabilize and move them to further support. I work with both the youth. I work in our program from 6 to 18 years old, so it's kind of a jack of all trades therapist. I work with both the kids and their families. That's a mandatory piece, which I really enjoy. A long time ago, 1992, I started working for an agency called Prevention Alliance, headed by Carol Thomas, who was a great visionary in alcohol and drug use prevention, and worked in the schools. I believe the schools are a great place because that's kids' place. That's where they are. I was the person they could go to, and it was confidential. In the grade schools, I would get the kids that would unload on teachers and overwhelm the teachers, and would work with kids who had parents who were using and needed support about living in that situation. Then I went into the public schools and worked on the Safe and Drug-Free Schools programming. When that money started to dry up, I became a school social worker, and now I am a therapist at Prairie Care, but I have a lot of concern about early intervention, identifying this, and challenging people's perceptions. Thank you.
Thank you. There's a timer here. What's that timer there for? To ignore. Oh, it's to ignore. Okay. My name is Saul Selby. My current title, I work for Minnesota Adult and Teen Challenge. I'm the Vice President of Clinical and Transitional Care. And at the age of 15, I decided to experiment with drugs and alcohol, largely due to some really unpleasant events happening in my family. Within a relatively short time, I became addicted. 3 out of the 4 people in my family struggled with addiction. And at the age of 27, I went into treatment, got sober back in 1979, 1980, and decided I wanted to work in this field because I thought abstinence worked a lot better in people's lives than addiction based on my own experience. So I worked at Hazelden for 18 years. My last position there was clinical director. I worked as a mental health practitioner for 10 years, where I had extensive experience working with families who were intervening, attempting to intervene on their adolescent children, trying to figure out, does my child have a substance use problem? If they don't, how can we prevent it? And in the last 4 years or so, I've been working at Minnesota Adult and Teen Challenge. And the reason why I think, let's see, why is early intervention important to me? I don't like suffering. I don't like suffering on a personal level. I don't like to see other people suffer unnecessarily. And addiction creates an unbelievable amount of suffering in people's lives. And it's challenging enough to help people stop using once they become addicted. And if you can intervene early on and help a person not go down that path, I mean, not only do you help them not suffer, but if they have family, as time goes on, they don't have to suffer as much either. Another level of early intervention I guess I was involved with it was as a parent. I raised 2 kids. To the best of my knowledge, neither of them had a substance abuse problem or have a substance abuse problem. They're not kids anymore. But I know that when they were teenagers, I was very engaged in trying to figure out strategies to do everything I could to prevent them from going down that path.
Good morning, everybody. My name is Abe Abrahamson. Currently, I'm the juvenile probation supervisor in Wright County. I started working with young people in the 80s, which will obviously give away my age. I worked in 2 different juvenile facilities. I also did about a year stint at the Bridge for Runaway Youth. I drove a Zamboni, for those of you who didn't know that. And then in the early 90s, I was hired by Wright County Court Services to be a juvenile probation officer, and then in 2000 promoted to the juvenile probation supervisor role. And I think there's by way of introduction, there's two things that have really impacted community corrections and the work we do as probation officers. The first one is the adoption of evidence-based practices. Before, in the work we did in the 80s and 90s, a lot of what we did was a gut feeling, and we were making decisions based on what our gut told us this person needed or didn't need. And then with the onset of evidence-based practices, we trained POs in motivational interviewing, we trained POs in effective case management, and we also started using the YLS, which is a risk needs assessment tool, indicating 8 domains of a young person's behavior, and that really helped us to identify who needs the attention and what are the needs of the young person we're giving attention to. But the second thing I want to talk about as probation officers, we have a philosophy in Wright County that the school really is a community for the young people we work with. So 20 years ago, we started an initiative, and this is why I think I'm on this panel, by the way, is we started an initiative in Wright County called Safe Schools. Basically, it started over a cup of coffee with a principal saying, we don't know your people, and vice versa. And pretty soon, this initiative grew into all 10 districts having the opportunity to bring key decision makers from the county together, including the county sheriff, the county attorney, human services, probation, and we brought school people together, and we talk about issues that are related to the safety of young people. Substance abuse obviously being one of those issues. So from that work we do with Safe Schools, there's just been, and I could talk about an hour just alone on all the positive outcomes. But we've started a lot of different initiatives. One is a alternative to out-of-school suspension. We run that right out of the courthouse, and we got a grant from JJAC to do this. So I'm sure I'll be talking more about that, but I just had wanted to mention those two things. Thank you very much.
Good morning, everybody. I'm John Choi. I'm the Ramsey County Attorney. I was first elected back in 2010, and I'm really happy to be here with all of you, and I want to thank all of you for taking the time out of your day to be a part of this and for the work that you do every day, working with our young people around addiction, and the work that all of you do is so important. From my perspective as the Chief Prosecutor in Ramsey County, I am the person, I guess, downstream, and I'm dealing with all of the society's problems and just some of the horrific things that people do to one another, and we try to figure out a way to obtain some level of justice when we deal with all of the criminal cases. But I can tell you that the vast majority of those individuals that come through the adult justice system, 2/3 of those individuals are going to be diagnosed as having some chemical addiction. And if you add on top of if they're there for drug offenses, the number even goes up much higher to about 80%. So what I see, the tragedies with respect to people entering into the criminal justice system, and also I also see a lot of victims because of their addictions who get caught up in being victimized by really bad people, because addiction is also a layer of vulnerability to be taken advantage of. And so I see all of this bad, and I'm convinced that what we really need to do is, as a community, as a state, we need to start thinking about how we really get upstream and think about how we actually prevent all of this from happening. And if you read the pre-sentence investigations of people that come through the criminal justice system, you will see, by and large, that for every one of these individuals, something went terribly wrong when they were young, when they were adolescents. And oftentimes, the addiction starts there as well. I see that as a driver of so much of it. And so, as a state, as a community, whatever we can do to start thinking about what we can do to get upstream, because think about all of the resources, the tremendous amount of resources that we put into the criminal justice system. And what we ought to be doing is we ought to be thinking about how we actually could get better outcomes. Because if it comes to my attention, I mean, we've failed as a society. And so I think what we can do is start thinking about conversations about how we invest and actually drive better outcomes on the front end, and that means working with all of you and making sure that these treatment and things are available, because I think that's one of the big barriers, and I'm sure we'll talk a little bit about that as well.
Absolutely. Can we welcome the panel? All right, let's jump right into this topic of early intervention. So who are the key stakeholders with regards to early intervention that play a role in this? And what are some of the areas of strength and what are some of the areas of weakness with regards to the key stakeholders? It's open to the panel. We told them about this, I promise.
I'll take a first step at it. For probation officers, especially juvenile probation officers, everything we do with 12, 13-year-old youth is pretty much early intervention. And so a key stakeholder obviously would be, a couple, would be the county attorney's office to recognize those cases that are low risk and then refer them to a diversion program. And at the diversion program, it's very important for that very first meeting with child and parent to hear a message loud and clear about what is expected, talk about the behavior, make a game plan. And for our diversion program, we have just the whole gamut of resources from a 1-hour class, a 2-hour class, all the way to outpatient and inpatient treatment. Now, I would say that parent engagement during those diversion programs is so important, and maybe a weakness would be sometimes those meetings might, people might not be comfortable in that setting, and parents might not be able to share what they want to say in fear of what this system can do to their kids, in fear of maybe getting their child in more trouble. And so I would say that is probably one of the downfalls, shortfalls.
Terrific, thank you.
You know, when I think about key stakeholders, I don't know whether, I'm thinking in terms of what's the most practical intervention, but I'll tell you probably the most key stakeholder is probably parents. So when a parent has to sit in a school classroom because of disciplinary issues, or has to sit, with the probation officer to address their child's behavior, that's maybe late in the game. Obviously that's important. I mean, one of the things I would say too, just again philosophically, I've been involved in the field for a long time. There's a lot of discussion about decriminalization, and I think, obviously we don't want to have long sentences for people whose primary issue is substance abuse. However, one of the primary reasons people get help is because of legal interventions. And if we take that out of the picture entirely, a lot of people are going to progress much farther along in their addiction than they would otherwise. But getting back to parents, people get driver's licenses, they get licenses to go fishing. They don't necessarily get a license to be a parent. And if we have learned over the course of the years, there are certain things that parents can do to insulate their kid against addiction, and there are certain things parents can do to facilitate the likelihood of them becoming addicted. We need to probably work hard at giving parents education early on, and just say, if you want to prevent addiction in your kid, here's 5 things you should do. And if you want to nurture addiction in your kids, here's 5 things you should do as well. There's a lot of research using something called ACEs. They're called Adverse Childhood Experience. So there's a lot of research going on around trauma, and so they test people to determine how many of these adverse childhood experiences they have, and there's a direct relationship between the number they have and the likelihood for them developing substance abuse. So this is helpful information to give parents early on in the process to make them more effective in their role.
Okay, well, I'm going to jump on the parent bandwagon and giving parents lots of help, but also being aware of kids that just is not going to happen, and giving them supports in other ways. and recognizing that and helping them. You mentioned trauma. And sometimes what we see is trauma where they've just lost the emotional support. So it doesn't get really labeled as a trauma. You know, we have nice little boxes, but sometimes that's just gone. And they're out there on their own, and they're going to find support, and they are going to find a group that welcomes them, and very often it is not the most healthy environment. So I think, you know, yay, if we can get parents on board, but if we can't, we have to have those other places for them to go. And the early intervention and prevention is so important, to start hearing their stories when they are alone. Thank you.
Well, I'll kind of spin off the parent thing. One of the thoughts that I've had is more so regarding teachers, and again, back to awareness and prevention. And the reason why I go there, I think this started back when I was a kid, and it's continued strongly for a long time, and that is parents, parents, parents. That's all we talk about is parents need to do this, need to do that. And we have a really tough time controlling parents and what they're doing. However, if we really step back and think about it a little bit, almost 25% of our children's wakeful hours during the day, throughout their from 18 down, is spent with the teachers. That's a lot of time they're spending with those folks as role models. So I think they're absolutely essential key stakeholders. And I think, maybe the weakness in that is that they're incredibly pressured professionals who have so much piled on their plate already. Now we're going to maybe potentially ask them to do one more thing. I think the answer to that is we need to make this a huge priority for them in this country. The other thing I think that's interesting as far as key stakeholders, I think everybody's a key stakeholder, but a couple of folks that came to mind through this. The other is really our politicians, our congressmen. I don't know if folks were at the Pain Pill Summit last year, but Dr. Chris Johnson put up this display of how many folks are dying in this country from prescription opioids, and he likened it to it's 5 World Trade Centers plus the Titanic sinking, and that's how many lives are died. So in the World Trade Centers, that was about 3,000 folks, which was a horrific tragedy. And I share that story often, and I get a very visceral response from folks. I think what's interesting about it, though, when I look at it deeper, after 9/11, 3 days after 9/11, our Congress gave executive authority to our president to spend $40 billion. Now, the projections right now from Washington, D.C. for 2017 is $31.5 billion spent on the war on drugs, however you want to call it. So that concerns me a lot. The other thing, you look at the World Trade Centers, since then there's a lot of numbers out, but they looked at it 10 years after 9/11, there was $4 trillion spent on that effort, fighting 3 wars. So I think, as much as I hate to throw money at things, this is a major crisis in this country, and we need to start putting the resources into it.
Thank you. You have a response to that, Saul?
Well, I have one more thought. Is it
Okay.
too late to throw a thought in?
No,
It
go ahead.
says 16 minutes and 42 seconds.
We've got a few more
it's
questions to
41
get to.
now.
We've got a few more questions to get to.
Okay, all right. No, just one more key stakeholder that I want to throw out. John mentioned our culture and its impact on creating problems with substance abuse with adolescents or adults, for that matter. I mean, one of the things that's bantered about right now is the legalization of marijuana. It's legal in 2 states, Colorado and Washington, D.C., I believe. And, one of the things that I don't know to what degree this gets evaluated when laws like that get proposed, but attitudinally, how does that affect young people's thinking regarding the use of an illegal drug, a drug that's capable of creating addiction, a drug that's capable of creating cognitive impairment? What I've seen brain scans of young people who smoke marijuana 2 or 3 times a week, and their brain functioning is significantly decreased. So as a culture to what, so stakeholders might be legislators and people that make laws, and asking the question, okay, if we decriminalize something, there may be some benefit in that, there are some issues that are resolved, but to what degree does that induce within the culture the likelihood that more people are going to experiment, use, and become addicted to drugs?
All right, we're going to move on to the next question. We'll start with you, John. And this question is, for you, you probably see a lot of people, as you said, kind of on the other end of the spectrum. But I'm sure there's a lot of reflection sometimes for them on, or realization of kind of what were some of those early indicators? What were some of the traumatic events? Or what are some of those early indicators of potential risky behavior, and then also what are the different types of intervening before it hits crisis stage?
Well, I think that's one of the big problems that we have is that we don't have the infrastructure and the financial supports readily available for everyone before it hits a crisis stage. And I think that's one of the things that I see as some of the gaps. We talked a little bit about the parents, and I think that is such an important part of this conversation. But it's not going to be the panacea, because a lot of the kids that I deal with in our juvenile system, I mean, their parents are checked out and they're not being helpful. And so the reality is for some of these kids, but they might have an aunt or a grandma or somebody that has got their stuff together and they can be helpful. But what does somebody do when they're not in the system per se? To get access to some help. I mean, if a parent raises their hand and says, I'm struggling, I need some help with my 10-year-old, it's not a very easy thing to navigate for a lot of these individuals. Like, for instance, if there's a crime committed, if any of you are a victim of a crime right now, we have an infrastructure in place. You call 911. But we don't have this infrastructure in place that's very clear for all parts of our society. And I think that's another important part of this conversation about how this infrastructure exists to do this early intervention and how it gets funded. Oftentimes it might go through private insurance, it might go through some public program or whatever it might be, but it's really a patchwork, and it's different for people throughout the state and depending on what your income is. And so I think that's one of the things that if we really want to have this prevention agenda and to avoid the bad that happens when we're in the crisis stage, we really need to start thinking about how to really have a streamlined way of creating a way in which people can raise their hand and say, I need some help. But that's, you see a lot of, and then also too, and that's for one category of kids. There's another category of kids where just traumatic bad things are happening to them. And those are some of the hardest cases that I have to deal with in the child protection system. And sometimes we have to take the extraordinary efforts to permanently remove children from their homes and from their parents. But there's another aspect of that too, I think, where we know if there's trauma happening to kids, I think that there are some intensive interventions that can happen to coordinate from a community perspective, because we know that if there's, like, for instance, trauma, one of the things that we're doing is we recognize in Ramsey County is if there's a domestic violence incident that occurs, we know right away that there's going to be an impact on truancy. And so we put some resources into trying to address that issue. But I know that there's some other risk factors that would certainly prevail around addiction and all of those types of issues as well.
Yeah. Abe, you talked about the safe schools, and how do you guys identify at-risk students? And then what are some of the ways you intervene before it gets to crisis stage?
Okay. First of all, the relationship that we have with our schools, we assign probation officers to an individual school district so they can nurture and develop those relationships with the assistant principals and the principals, and significantly the school resource officers. There was a time when school resource officers came into Wright County and everybody thought our caseloads were going to go through the roof. Everybody was worried that everything was going to be ticketed, and I can tell you this, it's completely opposite. We saw a lot of early intervention by school resource officers identifying some of the trends and maybe some of the concerns, pulling kids to the side, developing relationships with young people, And really, that was a real plus for us. Now, there's several situations where we've had different trends, kids selling prescription drugs in school. Of course, that comes to our attention. And if it's not a diversion type offense, a diversion meaning it's not going to go to the formal court process, but it's going to come directly to our office through the county attorney, then we can use different tools if it comes into our court system, whether it's outpatient treatment, whatever, and then everybody heard of the UAs. UAs is probably the least favorite job of any probation officer, I can tell you, but it is a nice tool for compliance. And not every, I mean, we really have a young population out there that, I'll give you an example. Our adolescent chemical education class, our instructor now, who is a probation officer, has to start with the statement, we're not here to debate legalizing marijuana. And we have the number one drug test that's failed is marijuana. So there is this mixed message going on out there about marijuana, use of whatever, gateway drug. But through our UAs, and then if we do have somebody that has a dirty UA, then we can intervene by stepping up the attention we give to those needs, whether it's outpatient treatment, we can do immediate sanctions, we can use electronic monitoring. All those things are in place to just try and get some compliance.
Terrific. Any other comments on the early intervention, intervening warning signs? All right, let's move on to the next topic here. We know the importance of who youth hang out with and the kind of the who and the what, right? Who they hang out with and what they do. How do we motivate change from high-risk situations to move into low-risk situations? They're chomping at the bit for this one.
Well, I think there's one statistic that's out there, and I hate to talk about statistics, but I know that for adolescents, in terms of them being successful in life, the more positive, caring adults that are in a kid's life really makes all of the difference. And I think that data is very, very compelling. So regardless of whether or not that's happening at the home, but I mean, I think this conversation about the influence that teachers, coaches, anybody in a community, maybe it's an uncle or a grandpa or somebody, but that I think that is so critical about the reality of kind of the trajectory of a child.
Absolutely.
We know that one of the struggles we have is when we talk to a young addicted person that we're concerned about the peer group they hang out with. It's really, really difficult for them to change their peer group. But the word that keeps coming back and that we use is trying to introduce young people to pro-social activities. And pro-social activities can be any school-related activity, any clubs, anything of that nature. And the probation officers that work in my department are really good at trying to identify some of those resources for young people to just introduce them to maybe some different healthier lifestyles and maybe gravitate away from some of those negative influences.
Terrific.
One of the things that I think can be helpful along these lines is if you've got a relationship with a young person and they're moving towards 12 or whatever, I don't know what the average first use is or first exposure to substances at this point is, but before that actually happens, if you have the kind of relationship with that person where you can say to them, look, at some point in the future, somebody is probably going to offer you a joint or ask you to drink alcohol before you're legally able to, or maybe offer you a pill of some kind. If that happens, how do you think you should respond? And what you do is you create a dialogue around that so the person is prepared and equipped to respond to that event if and when it happens, so they've kind of practiced a response. That can be very helpful with some young people. The other thing along with the idea of a helpful adult is that I think we all understand that sometimes adolescents don't like being completely honest and open about their lifestyle with adults, and if they're involved in behaviors that are clearly in violation of what other people are expecting, they're more likely to be dishonest. And so if you can create a relationship with a person where they're not feeling judged, and just say, hey, look, I know that at your age it's not unusual to be exposed to drug and alcohol use, and I know it's not unusual to even experiment with it. Can you tell me what's going on in your life around these areas? You know, and if they feel like they can trust you, you're in a better position to actually get some good information that you can at least respond to.
I think one of the areas that I feel we've been very successful in our local county coalition. At any given point, we will have 20 to 30 very active members with, I think, 17 different sectors of our community, and from law enforcement to healthcare to the schools to, you know, the spiritual leaders in town. You know, a very diverse group. A few years ago, somebody came up with the brainstorm. I wish I could say it was me, but it wasn't. That why don't we have these kids here with us in our meetings every month? And so we worked with the school counselors, and that's indeed what they did. They went back and sort of created their own coalitions or groups within the schools, but then they invite them to the coalition meetings. And it's very fascinating because you kind of know deep down these kids are just super excited to be there because they get to miss a couple hours of school, right? But I can tell you, they're enamored. They're not visiting with each other, and they're not horseplaying. They're listening to the conversation and actively giving input. They really want to help. They're fascinated with it. And some of the stuff that they've been able to take back to their schools with events and lockout events and just daily efforts within their schools being supported by the coalition has been really positive.
Terrific. So next question is kind of going off of what Saul brought up, that ACEs, and kind of looking at what are some of those things that, whether it's traumatic events, and maybe Linda can answer this in your work, what are some of those, how do we be aware of kind of, we hear a lot from adolescents after kind of hindsight's 2020, the cry for help, the behavior, the acting out. A lot of times it's a sign that they want help. But how do we be more aware in those times and more responsive? And what are some of those things that make up that list also, Saul, that we can look for in the work that we do with youth?
Well, I think there needs to be a return. There used to be a lot of community groups, particularly for kids in disenfranchised groups, but just kind of drop-ins and places where they could feel welcome and have an ear. I want to go back to the school. School is where kids are, and having a lot of things, and whether or not it's after school and then making those things accessible, that's the other piece. It's the money. Do they have bus transportation? Can they get to places? And so identifying those kids, giving them information, and then giving them the how-tos of how to access it is probably prime. They want it. It's just got to be accessible.
I think some of the things that are pretty well understood to be at least concerning behaviors, significant mood changes. I think most adolescents are prone to mood change for hormonal reasons and maybe others. But I mean, if somebody's beginning to experiment with drugs and alcohol, the mood changes might be more pronounced. And of course, the people who are most likely to abuse drugs and alcohol are people who don't feel great to begin with. So if an adolescent is pretty moody, they might be seeking ways to get relief, and they might be more open to experimentation. And if people are coming home late, they're violating rules, they're not getting their homework done, their grades are dropping, they're hanging out with the bad crowd, whatever the bad crowd may be, those are other indicators that are worthwhile to begin a process of exploration. Is there something going on here regarding substance abuse? One more thing I just want to mention real quickly, another insulating factor. There's a ton of research out there about the relationship between involvement in religious activities insulating young people against substance abuse. There's a research, there was a study done back in '91 called So Help Me God that basically said that kids that are engaged in church or other religious groups are less likely to use and abuse drugs.
All of us wear many different hats working with young people. Probation officers, no different. We wear many, many different hats. But one of the things that we really strive to do when we work with young people, and I know this is the model from years ago, but it works, is developing relationships. And if you can, as a PO, work with a young person who sees you as somebody that's going to be a positive, caring adult in their life, who certainly knows you have the ability at times to make their lives very uncomfortable, but building those relationships, we hope that when there is those times of acting out or those times of crises, that the young person and or parent, if you're engaged with the parents, can really identify maybe what some of these kids are going to need, and through motivational interviewing you can help them get to that point of addressing their issues.
Terrific. Well, this time we'll open the text line as well. So now is your chance to engage. If you have questions, any comments, anything like that, feel free to start sending them in. And as they start coming in here, maybe someone can touch on this part, this kind of topic that can be challenging. When navigating gender-specific issues, what are some of the differences and areas of focus that you guys find in your work with adolescents?
I can just make one real comment, and I hope you don't know. If you don't know, you should. Locally, we've done several surveys and focus groups and put attention on parents and kids, and we use the Minnesota Youth Survey, and I think nationally, there's not a lot of gender differences. We found that in our small little rural community. The numbers are straight across the board, boys versus girls.
Yeah.
One of the things, and I think it is not gender, in youngsters, in gender specific, but as I get to know kids, and particularly kids who are using, and you start to hear the story that they may be medicating something from earlier, but then it starts to compound itself. In their use, other bad things happen that they're very ashamed of. They don't want to admit because they were under the influences happened, and so they feel at fault for having some other traumatic events happen, and it starts to compound, and they don't know how to control it.
Thank you. All right, we've got some questions coming in here. This question is for the county attorney, Mr. Choi. Could you speak about your county's efforts to identify at-risk families for adolescent chemical abuse?
Well, in terms of the proactive effort, I mean, there isn't much happening in terms of being proactive about it, but I think what happens is if they come into the system, then through the court process, whether it's a juvenile or an adult case, there's going to be somewhere in that process there probably would be some sort of chemical evaluation. But that's, I think, one of and this is not just in Ramsey County, this is, I think, across the state. I think that's one of the big barriers and the problems that we have is that a lot of, I mean, there is value in having the criminal justice system involved because oftentimes, for people who are suffering from addiction, it's not until that they hit rock bottom, oftentimes, that they're going to actually say that I need some help. That's for a big part of the population. There's another part that might right away be amenable to treatment or whatnot, but everything is structured around really some event that happens from a crisis reactive standpoint, but from a proactive standpoint, I mean, does Ramsey County or government proactively go and look for and to help families that are struggling through addiction? Not unless something happens. And I think that's not just Ramsey County. I think that's across America, and that's something that we ought to be thinking about, having that infrastructure of resource so that it is very known and accepted by our community that if any family or any person is struggling through this health crisis, because we should be looking at addiction as a public health issue, that there ought to be resources to be available for those families and those individuals.
Terrific. All right, we got a lot of questions coming in. What are your thoughts on incorporating mental health screening into the schools? Abe, as you work in the schools, what are your thoughts on that?
Well, I could tell you this. We started using the MAISY mental health screens 10 years ago, mandated by the Department of Human Services. And it's a screening tool, for those of you not familiar with it, that just kind of gives us a snapshot of where the young person is. And puts us into a position of saying, you know, we probably need to focus some attention on this, and then, because we're referral-based, oftentimes then be referred to a mental health practitioner. I think it would be important for schools to have that. I think maybe some schools are already doing that. Maybe some school people can talk about that, but I think that would be a really, really important tool for schools to use, a screening vehicle of that nature.
Terrific. All right, so a few questions here kind of geared towards some of the challenges with interacting with youth. This one is with regards to the marijuana issue. The thought of it's not that big of a deal, it helps me think, it helps me relax. What are some responses to that?
Show them, I've got pictures of young people's brains, SPECT scans that have been using marijuana in a fairly limited way, and basically what it indicates is that blood flow is being significantly restricted to key parts of the brain. I think there's research that suggests that their IQ goes down about 6 points if they use marijuana on a regular basis. So there's a lot of very practical, hard medical evidence. We can show people that this is not harmless. It's destructive, it's damaging. And the thing is that when they're using it, because the very thing they need to access to make good decisions is impaired, it's that much more difficult for them to recognize the problems associated with it. But if you look at the biomedical stuff and just kind of show that to them, that can be very helpful.
One of the pieces of the conversation I have with kids is that, you know, even if it's legal, it's like alcohol. There's an age on it, and that age is there for a reason, and that is about developing brain and learning. And we know that the earlier somebody enters into their chemical use, the more likely they are to develop a serious problem. I just look and I go, it's not an issue for you right now. It is still the same information, and trying to say, you know, it makes you relax. There are other things for relaxing, and what's the problem that you're having accessing to be able to relax yourself, and switching the topic to what are you missing as opposed to the marijuana debate.
All right.
I can speak just a little bit to bounce off with the brain scans. It's a great idea. I hadn't thought of that. But I'm fortunate to have, one time I had 4 teenagers in the house and had this conversation many times. And I was blessed with being able to simply point out family members and friends who, for lack of a better term, were complete stoners. And I said, do you want to be like them? I said it all the time, and you know, that seemed to help.
Terrific. So lots of questions with regards to the comments about parents. Parents can be a very difficult population to engage. How do you reach them? Oops, sorry. Came off my question. How do you reach them to have them understand the dangers of allowing their kids to experiment with alcohol?
I think it goes back to a bit of what I've been saying all along. It's an awareness. The sheriff, the local sheriff, and I have been talking about this for a while. Unfortunately, so often it takes a crisis. We've been very fortunate in Kanabec County to not have a crisis that is really public knowledge that everybody knows about. And I don't want to have that in order for that to float to the top. But You know, we're planning to do community forums. I think every community in the state of Minnesota should do it because it is truly an awareness thing, and we've learned from several communities that have done it that they're getting droves and droves of parents there, so that conversation starts. I think, you know, that's key.
Linda, there's someone specifically asking for you to kind of chime in on the mental health screening in the schools, just because of your work in the schools and as a social worker. What are your thoughts on mental health screening in the schools?
I think it would be very good to have somebody trained. And when you have those kids that are showing up either in the office all the time, for behavior issues, or in the guidance office, and they're going, okay, we've got a frequent flyer here, and let's start to really look more what's going on. I'm not sure that I would pass it out in homeroom and have everybody take it. But I think when you start to see those frequent flyers and those kids coming in late every morning and all those other signs, I would say, yeah, let's have a conversation and see if they're willing.
So we are out of time for this first panel. So right now, we have a little bit of a break. We want to encourage you to engage with the exhibitors out there. Get your bingo cards filled out. We'll be doing a couple door prizes throughout the event. Can we thank our panel members for participating in? If you have any questions, there are individuals with logo T-shirts around that will be able to answer questions. Please remember to continue the conversation online. We'll be showing our tweets throughout the day. Thank you so much, and we'll reconvene in 20 minutes.